Hello, I'm Dr. Mugdha Raut, a clinical reproductive immunologist and gynecologist at ICPRM, that is Dr. Raut's Center for Reproductive Immunology. Yesterday, I got a phone call from a family physician from Ludhiana. She said, I have a patient of 8 miscarriages and 3 times IVF done, yet no pregnancy. Can I refer her to you? I was a bit surprised. During my conversation with her, she said that I am the couple's family doctor. I have been seeing them for a long time. I was aware of their fertility issues, but last week they told me their fertility journey and asked if there is something else they could do. So I started researching for the couple and came across your videos and website. And I decided to ask you. I was so happy to hear that a family physician researched for the couple. So I decided to make this video. I'm sure that every doctor of any specialty, whether family physician, general practitioners, a doctor friend, a doctor who is a relative of any specialty has seen such patients. The mother in law, or the couple comes to you saying, she has, or we have been trying to conceive, or a similar history which the doctor from Ludhiana shared. Every routine test is normal, or perhaps they have suffered 2 or more miscarriages, or they have already gone through IVF or multiple IVFs which have failed and are simply told to try again. The question is, could there be something else that hasn't been evaluated yet? And yes, here's a reality. The immune system was probably not checked. Many doctors and patients are not aware about this aspect of the role of the immune system in repeated miscarriages, IVF failures, or unexplained infertility, now labeled as reproductive failures. During medical studies, reproductive immunology is yet not a part of routine medical education, and that's completely understandable because fertility medicine has evolved rapidly and immune factors remain outside the standard workup in many settings. This does not mean reproductive immunology is replacing conventional investigations or treatment. Those remain essential. Why am I saying this? Let me tell you one of my experience. One physician referred one patient because the patient did not want to undergo IVF. In reality, there was a severe male factor in this couple who required IVF. Reproductive immunology does not replace IVF or other conventional treatments. It's about recognizing when conventional investigations have reached their limit. That is, when another biological system, that is, the immune system, deserves attention. So, today, let me tell all doctors who are listening to this video, consider referring couples to Dr. Raut's Center for Reproductive Immunology in the following 3 situations where an immune evaluation may be worth considering. First is a couple with unexplained infertility despite a normal routine workup. Second, a woman who's conceiving naturally but has either 2 or more early miscarriages, late miscarriages, early onset pregnancy induced hypertension, where common causes like genetic, hormonal, and anatomical have not explained the losses. And third is a patient returning after 1 or more failed IVF cycles with good quality embryos, but no clear reason for failure. Remember that these are the patients who often continue moving from one treatment to the next while the same questions remain unanswered. This is where your role for referral to Dr. Raut's Center for Reproductive Immunology becomes important. So, then what do we do at Dr. Raut's Center for Reproductive Immunology? At Dr. Raut's Center for Reproductive Immunology, we first perform a comprehensive immune evaluation for the couple. And when appropriate, patients may be offered ImmuLIT, which is our patented immunomodulation procedure done only by Dr. Mugdha, that is me, and Dr. Mohan Raut. It is designed to help promote maternal immune tolerance towards pregnancy. It is performed in a single sitting over approximately 3 hours, supported by more than 3 decades of clinical experience in reproductive immunology. And most importantly, we are not taking over the patient. Our role is focused and complementary. We assess the immune component, provide ImmuLIT treatment where indicated, and the patient returns to you or their IVF specialist or gynecologist for ongoing care. We believe that fertility care works best when doctors work together and not separately. If you have patients with unexplained infertility, recurrent miscarriages, or repeated IVF failures who seem to have reached a dead end, perhaps the next referral from you isn't another protocol. Perhaps it's an immune evaluation. For the couple who has tried everything, one thoughtful referral from you may uncover what has been missed. We would be happy to discuss whether reproductive immunology may have a role in your patient's care. You can contact us on +91 98208 94047 or +91 98201 83757.